Hello, mamas, and welcome back to the B3 Mastermom. Thank you so much for taking time out of your busy day to invest in yourself and your own development. Today's topic is bod, and I have been dreading this section because personally it is still, years later, the hardest one for me. I find it so difficult that I broke this section down into 3 parts for you. The first part you got right away when we spoke to our OBGYN. Today's section is all about your physical body, and then the next video that you watch is going to be about your body, but from a nutritional standpoint, what you actually put inside of it. And it's funny how all the B's on our wheel really do blend together for a balanced and abundant life. Today's agenda starts off with answering the question, when am I going to get my body back? And if you remember me telling you from the very first video, the spoiler alert is that you won't. You will be stronger and you will be better. We are moving forward, not backwards. And I will share a body story with you today because you guys are now fully immersed into the B3 Babes community. We have another expert interview with a physical therapist who covers specifically the pelvic floor. She's going to talk to us about our pelvic floor. She's going to talk to us about our core, and she's going to talk to us about the importance of moving our bodies. And we couldn't talk about our physical bodies and our physical strength without also touching on social media today and the impact that social media has on our bodies. We will have time to reflect in our journals and we'll prompt you along the way. And like always, we will end our time with scripture and prayer. So let's go ahead and get started. Okay, so when does mom get her body back? We have talked about how labor and delivery is a trauma. Well, when you put it that way, by definition, Physical Therapy and Sports Medicine Institute says that a physical trauma can take up to 9 to 12 months to recover. And I've had both my ACLs replaced, and that is absolutely true. So when we think about physical recovery, from a trauma perspective, this requires the remodeling of soft tissue cells and the ability to develop your strength back, both of which are going to take up to a year, no matter what society tells you, no matter what the doctors are telling you. And yet as mothers, whether we have a vaginal birth or a cesarean birth, we're expected to bounce right back, right? Well, postpartum recovery, and by postpartum, I mean the season after labor and delivery, this season, it is no different. This trauma is no different. Your body is so important. It needs time, which is why in our business video, we talk about the global perspective on the length of maternity leaves. So I can't wait for you guys to tune in for that one. But for now, we have to consider not only our soft tissue down there, our soft tissue up here, but what about our lack of sleep, our hair loss, our sexual changes, our weight gain, or our lack of weight loss? All of these different things are going to factor into our recovery. And just the balance of a new routine can be a stress factor that will impact the way we heal our bodies. Our OBGYN friend Rachel told us that it can take 6 to 8 weeks for the swelling of our uterus to just go down. Additionally, the placenta and the extra fluid that you had when you were pregnant to protect that baby in utero, it's about 2 pounds, if not more. However, getting your old body back is not a numerical formula. And this is what society tells us. You have your pregnancy weight minus the size of your baby, minus the size of the placenta and the fluid, minus your swelling, should equal a mom bod. Well, that is not true. Your bones have changed after pregnancy. Your ribs are now in a new place and they won't go back. Your hips are now in a new place and they won't go back. Even your spine might be shaped differently. For example, your hips will forevermore be slightly wider than they were before labor and delivery. And they're going to grow slightly wider with each child that you have. So if you're wondering why your skinny jeans won't fit even though you are back to your pre-baby weight, it's because of your bones, not the size on the scale. You are in a different body. No matter how much kale you eat, no matter how many crunches you do, you have evolved. Okay, so now that we know we're not going backwards, we're going forwards, it is our opportunity to reflect on the swelling, the body, the tissue, the bones. Where is your body today physically on a scale of 1 to 5? Go ahead and plot it now on your B×3 wheel. If I'm honest, even 6 years later, my body, I'd say it was at a 3 right now. If you had caught me 12 months after Gio, my second, was born, I would have definitely said a 1. And guess what? The number on the scale has not changed since Gio was 1 year old. But my mindset has. I was always the tall, lanky kid growing up. And leading up to our wedding, I tried every diet, every workout. I had such a bad relationship with my body that I purposefully purchased my wedding dress one size too small to motivate me to lose weight so that I would look hot in these pictures that would last me forever. And guess what? I did. I was the smallest and the fittest that I have ever been since high school. But guess what happened? On our honeymoon, it all came back. And it came back with a vengeance. And now when I look at my wedding photos and when I explain those wedding photos to my daughter, who I want to have a great relationship with her body, I don't say, wow, mama looks great. I look at those pictures and I think about how unrealistic it is to sustain that body forever. And this was before kids. As you know by now, my husband and I then suffered infertility for almost the next 4 years. And in those 4 years, my hormones, my lifestyle, my stress caused me to go to the heaviest that I have ever been. I was definitely uncomfortable in my skin. Then when I got pregnant with my first, Gabby, I had such bad morning sickness that I ended up losing 19 pounds in the first trimester. I was literally living off of lemon, lettuce, and watermelon. That's all the baby wanted, and those are still things she likes to today. You know how this story goes. My body was only about 6 weeks postpartum with Gabby when I got pregnant again. So let's remember that uterine swelling that Rachel was talking about. Still swollen. Let's remember the soft tissue that needed to heal. Still not healed. Let's remember the bones that had widened. Still not moving. We just discussed that they don't heal for a year. And yet Gio started growing and moving all these things inside of me. This time, not only did my hips move, but my spine moved as well. And I started suffering terrible sciatica throughout my pregnancy with my second. I also slowly started losing control of my bladder. I remember when my water broke with Gio, I just figured that I peed my pants yet again. When I realized that it wasn't pee and that Gio was coming 6 weeks early, I had to call my husband Kenny to come back home and we headed to the hospital. My body has been through hell and back twice, and I respect it for that. It wasn't until about a year ago that I had a really wise woman at my church look me in the eye and tell me, Nancy, you have more energy and strength than any mom I know. Did you ever think that the body that you're in today is the one that God wants you to have. It might not look the way you thought it should, or it might not look the way others in society are telling you that it should. But did you ever think that this is your ideal body? And it's exactly the way God created you. Girls, I was a babbling mess at her kindness, at her honesty, at this new perspective. She spoke such life into me that day that now I want to speak some life back into you. I learned of this analogy that really helps me embrace what this kind woman was trying to say about my body. I want you to think about your mom bod as a butterfly. Butterflies start out as caterpillars, but God created them to be butterflies. That is their ideal state. Their soft tissue has to move around to be what God created them to be. Well, your mom bod is the same way. Your hips were designed to be a little bit more open. Your soft tissue was made to be more flexible and to heal into what it is right now. You do not see butterflies flying around trying to get back into the cocoon, do you? No, they are free. They are beautiful. They are the strongest version of themselves, and they're living life the way God created them to. And mama, so should you. So in your journals, it's okay to mourn your caterpillar life. Write it down. Thank God for that season. But now ask yourself, what does the transition out of the cocoon need to look like for you? And more importantly, let's start dreaming about our beautiful butterfly bodies. It's strong, it's flexible, it's beautiful. Yes. Write those thoughts in your B×3 journal now. So here is where my beautiful and brilliant friend Liz comes in. Liz and I met about 4 years ago in the lobby of a dance studio. Our daughters were taking ballet together, and she had just moved here to South Florida. And like all awkward mommy encounters and introductions, we chatted about how cute the girls looked. But then we started looking forward to our lobby chats, and the conversation started to evolve into deeper mommy conversations. And I learned about the brilliant work she does with physical therapy and the pelvic floor. I also started inviting her to the small group at my church where we could talk about marriage, we could talk about the kids, we could talk about our spirituality. And the girls became fast friends, but so did we. I can't wait to share her with all of you. This is Dr. Elizabeth Templeton. Liz earned her bachelor's degree in kinesiology from Temple University. She has a doctorate degree in physical therapy from Arcadia University in Pennsylvania. She is a board-certified pregnancy and postpartum corrective exercise specialist through Herman and Wallace Pelvic Institute for the advanced education of pelvic floor disorders of all kinds. Liz is super passionate about educating the community and students and her current practitioners on pelvic floor disorders. She has taught continued education courses locally as well as presented at conferences. Currently, she is the visiting instructor at our local university, Florida Gulf Coast, where she has just launched a physical therapy and rehabilitation clinic for our community in South Florida. Her current area of practice is treating pelvic floor disorders with a special interest in pregnancy and postpartum. Liz is an avid runner. She's a woman of God, she is a wife, and she is a mom of 2. I cannot wait for you to hear what she has to say about the mom bod. Liz, thank you so much for being here with us today. We are so excited to hear everything that you are going to share with us. Thanks for being here.
I'm so excited to be here, Nancy. Thank you so much.
It is my pleasure. So you are a medical professional and you are focused on our little nether region down there. So what are the top 3 things that you would talk to a new mom about?
Yes. Well, I'm so happy to be able to do this because they really don't get this education anywhere else. It's all about the baby after, at this point. So I'm so excited today to talk to you about your pelvic floor, your core, and then start talking about some movement. So then what do we do? Let's
Yeah.
get moving again.
Let's get the body moving.
Yep.
Yep. Okay, so the first question, the pelvic floor. I mean, I've heard vagina, I've heard pelvic floor. There are some moms watching this that have had a cesarean. So, why is the pelvic floor specifically important?
Yes, great question. Well, I brought my little friend here too
Yay.
because a lot of us don't even know what the pelvic floor is, okay? And so the pelvic floor, this is your pelvis, okay? So this is the front of your pelvis. This is your pubic bone, okay? So that nice little pubic bone there. And then this is the back of your pelvis, your
Right.
tailbone, okay? Just to
Okay.
orient you,
Yeah.
okay?
Helpful.
It'll help once we start talking about what it is, okay? So inside of your pelvis, if we look inside there, we have a group of muscles and ligaments and tissues, and they rest inside of your pelvic cavity. So that's your pelvic floor, okay? These muscles of your pelvic floor are what we're really going to focus on today, okay? So those muscles, they start at your pubic bone, okay? They go around your urethra, your vaginal opening, around your rectum, and they attach back to that tailbone.
Okay.
And then they open up almost like a hammock, okay? Or you can think about them like a bowl. There's 3 layers of these muscles, okay? So these muscles are thick, all right? There's a lot of them. So they are so important for many reasons.
Okay, now that we're oriented,
Yes.
What's going on?
Now that you know where they are, all right, these muscles serve really 3 main functions. They have to be supportive, right? They supported your baby, okay?
Yeah, right.
After you had the baby, now they're supporting your bladder. They're supporting your rectum, and they're supporting your uterus. So they have to keep all these organs up inside, okay?
We don't want them to fall out.
We do not want them to fall out. They also have to keep our pee and our pooping,
Right.
okay? So they have to stay contracted, which thank goodness these muscles are very smart and they stay contracted most of the time throughout the day, or else we'd be peeing and pooping all over ourselves constantly,
Right.
okay? But then they have to relax to allow you to have a bowel movement, to allow your urine to pass all the way, okay? And then finally, these muscles assist with sexual appreciation.
Yep.
So these muscles are what help us have a good orgasm. You probably might not be thinking about that right now, but eventually you're going to get back to that. And these muscles are going to assist with that.
Yeah, and Rachel talked to us about this common thing that's said in the labor and delivery room of like, hey, put an extra stitch in there. And it's like, well, what exactly are we stitching? Because it's all kinds of stuff that needs to tighten and relax, right?
Yeah, exactly. So when you have your baby, what happens, and in fact, half of the births in the US are vaginal births, more than half really. And a portion of those, the women suffer tearing, right? Yep. So you get this tearing through here, through this area. So it's right in between your rectum and your vaginal opening. So that's really what you're thinking about when they're stitching that. So that's an injury that can occur, right? And so if we think about sports injuries, this is an injury that can occur that we can treat and that can be treated. You don't have to live with that.
Right.
So if you are having pain with intercourse, which is common, okay, but not normal.
Right.
So you might experience that. And that's something where you can do, just like we do, massage on our shoulders, we can do massage to that area. All right.
So you mentioned the word trauma, and we've talked about this a couple of times in different videos, but talk to us about healing the pelvic floor and why that's important. If we don't heal the pelvic floor, what happens?
Yes. Okay, great question. So if our pelvic floor doesn't heal, either naturally, which can happen, or with intervention, you can suffer from things like pelvic organ prolapse. So you said, I don't want those organs falling out. And that's what pelvic organ prolapse is. It's actually a descent of either your bladder, your uterus, your rectum can actually descend through that vaginal wall, Okay.
My mom has had her bladder pinned up
Yes.
because of that, right?
Yes.
So
Yep.
we got to move everything back up.
And unfortunately, childbirth is a risk factor for this occurring. So that's something that can happen. So if we don't strengthen those muscles, all right, and keep everything nice and strong, then that could be a consequence if we don't take care of our pelvic floor. Okay.
So that seems pretty drastic, but what about like I still have very low control of my bladder. Moms pee all the time.
Mhm.
Why?
Yeah. So again, what can happen after, well, think about when you were pregnant, right? You probably had to go to the bathroom more frequently when you were pregnant versus when you weren't. That's because this baby is sitting on your bladder, which rests right here, okay? And your pelvic floor is trying to support that. But now you have all this pressure on your bladder there, okay? And so during pregnancy, you can do pelvic floor exercises to help strengthen. But after pregnancy, where you guys all are now, you might have even had either some injury to those muscles that help contract your around your urethra here, where your urine comes out. So tearing of those muscles or damage to those muscles during, especially vaginal childbirth, can occur.
Yeah.
So that could be one cause. So when you laugh or cough
Yes.
or sneeze.
There's no jumping on the trampoline anymore,
Yes.
ladies. I'm sorry to tell you.
Or maybe even when you're going to pick your baby up or getting the stroller out of the back seat of the car, you might be like, I just peed my pants. Why did that happen?
Yes.
Well, one, you could just have injury there, stretching even of those muscles that aren't closing around the urethra enough. So when you cough and you sneeze, you're not getting that contraction to keep the urine in. And that's a very common occurrence as well. Again, not normal, all things that we can treat.
Right. So this doesn't have to be our new reality.
No.
We can take interventions.
Yes.
What about if a mom is constipated? We know that like, hey, pooping releases you from the hospital. Is that pelvic floor related too?
Yes, completely. And just like I showed you where these muscles go, how they go surround the rectal area, these muscles control that relaxation that can help and assist with having a bowel movement. So it could also be the opposite that we see. And a lot of times this isn't reported by women, maybe because of embarrassment, but they might have fecal incontinence. So we addressed urinary incontinence, but they might have, from the tearing that occurred, injury to that muscle that helps shut off your poop from coming out.
Right.
So you can suffer from that. But on the constipation side, yeah, there's definitely some things that we can do to help relax the pelvic floor. Everybody gets prescribed these things called Kegels that you may or may not have heard of,
Yeah.
or that packet that Dr. Wykes talked about that you go home with probably has Kegel exercises in it. But none of us are looking at that. I don't think I ever opened.
Me neither.
You know, I was too obsessed with how many times the baby pooped,
Yes.
let alone did I poop, or
Yes.
what's that even feel like, you know, during that time period. But yes, if we're not relaxing enough after that time and all we're doing is Kegels, then our pelvic floor is not going to be able to relax to allow a bowel movement to occur. So we can address that as well.
Okay, so this pelvic floor has everything. It has our sexuality tied to it. It has our bowel movements, our urine tied to it, and we have to strengthen it, but we also have to relax it, right?
Yes. Yep.
Okay, so in your journal, have you thought about how important your pelvic floor is? Do you even know where it is? Have you done some sort of assessment to figure out where it is, how strong it is, and how you might strengthen it or help it relax? Go ahead and spend some time in your B×3 journal now. Okay, Liz, so now we know where our pelvic floor is and what to do to strengthen it and to relax it, but I have a feeling that the pelvic floor isn't all acting on its own. So talk to us about our core. Why do we still look swollen and pregnant?
Yeah, that is a really good question, and a question I get very often, especially with moms who are more 6 months, 12 months, 2 years postpartum. It's, why do I still have this mommy tummy?
Yep.
And there could be lots of reasons for that. And, you know, one could be, you know, just that your uterus is still shrinking, you know, those first 6 to 8 weeks. That's very common, swollen. So that's got to shrink down to size. When you're pregnant, you gain more fat around that area to help nourish the baby.
Yes.
So maybe you still have a little bit of that left over in
Yep.
that area. Could be genetics, okay? It
Mhm.
could be that, you know. It could even just be a simple fix of your posture. You could even be working on your posture. We're sitting here like this, right? We're all guilty of it. Or you're feeding your baby like this, and you're just putting so much pressure on those abdominals. That's not helping your case at all, you know, to help with that. But the real thing I want to talk about is the core, and something called a diastasis recti is one of the major reasons why women will be doing all these exercises and say, I still look this way.
Yeah.
So when we think about the core, let's not just think about our abdominals. And that's a big issue, is that people just do crunches after crunches after crunches, or planks or pull-ups or whatever they're doing.
Right.
And they're forgetting that your core is actually made up of your abdominals in the front. You have deep abdominal muscles that actually wrap around your body and attach to tissues that attach to your low back. So they're like a corset, or that belly band that you guys might have worn.
Yep, I wore one of those.
You have deep abdominal muscles that are in that position.
Okay.
And then you have muscles on the side of your body. You have oblique muscles, you know, for your abs. You have your back muscles that are all part of your core. So you don't want to forget about those too, because they can help reduce the pressure that you're giving to the front of your body. Then finally, the pelvic floor is the floor of the core.
Yeah.
Okay. So we have to make sure we're working all of that and not just doing sit-up or crunch after crunch. Not to say they're bad. It's just you might be doing them incorrectly and not engaging the right muscles.
Okay, so engaging the right muscles is important, because whether we're doing a sit-up or picking up the baby, this is all going to impact how strong our bodies become, right?
Yes.
Okay.
Exactly.
So what happens if we're figuring out how to engage all of the right muscles everywhere, but for some reason it's still a bit distended? Is there some sort of case where something else is going on?
Yeah, and that could be that diastasis recti. And
what is that?
Okay, so what that is when you're pregnant, okay, you may have seen a dark line down the center. Yeah, okay. So that line, that's a connective tissue line that runs down the center of our body, and it connects those rectus abdominis, those six-pack muscles, okay? So naturally, that muscle, those muscles, they have to spread out to make room for the baby. So that's very, very common. So what we know is actually, if you go all the way to 40 weeks of pregnancy and you make it all the way through your gestation, that we found in studies up to 100% of women have some sort of diastasis or separation of those muscles there, okay? Now, in about 30% of those women, okay, they heal spontaneously up to 6 months, okay, afterwards. So after you have that baby at 6 months, we found that like 38% of women
muscles go back together.
Muscles went back together spontaneously. They just did it on their own, right? But we do know that some women need a little help and some intervention there. And you might even notice that you've got a separation in your abdominals and might not know why. But that could be a reason for that pooch still at the bottom, because you're not able to engage and you're not able to cause what we call tension of those muscles.
Okay.
Because of that separation.
So we're going to do in a minute kind of an assessment of, is my tummy just a mommy pooch, or is my tummy disconnected from the body? And so we'll want you to do that same type of test as well, and then seek help with some of the resources that Liz and B3 have provided. So for now, let's ask ourselves in our journal, do we know what our core is? Are we actively engaging the muscles that let us sit up straight, that let us pick up the baby, that make us strong? Let's go ahead and reflect in our journals now about your core. Okay, Liz, so we've talked about our pelvic floor. We've talked about keeping our core muscles strong, and that's more than just our six-pack. But as moms, do we go back to the gym? Like, how do we do all of this? Why and when do we start really moving our bodies?
Yeah, that is a great question. And you don't have to go back to the gym, right? I mean, everybody's on their own timeline. And we've talked about that with healing. Everybody heals on their own. Unfortunately, we get this guideline that's kind of arbitrary of, oh, 6 weeks, you go to your doctor. I know I did. I went to my doctor. They checked me out. They said, yep, you're good. Go back to exercise. But really, maybe I was healing, but am I really ready? I mean, I'm a runner. Am I ready to return to running?
Right.
So we don't really have a specific guideline for the general population. It has to be very individualized.
And even more individualized from a vaginal birth to a cesarean birth to just your body.
Yes, exactly. So what we look at and what I look at with my patients is, what were you doing before you exercised? What was, how fit were you?
Did you go to the gym every day even before you had the baby?
Exactly.
The answer was no for me, and it's okay if the answer was no for you too.
Yes, and I think sometimes we just have these beliefs, we've got to get this body back, but it's not the same body anymore, So what were you doing before is going to really determine, and what you were doing during pregnancy.
Yes.
So, if you didn't exercise during pregnancy at all, you can't expect at 6 weeks when that doctor gives you the clearance, hey, I'm going to go run a marathon. Like, that is just not realistic. But sometimes we feel that we need to be that way. We feel that pressure.
So then what is realistic? Let's say we're at 6 weeks and we know we need to start moving. Is this simply just putting the baby in a stroller and getting outside for some sun, or what would be normal?
Yeah, that's great. So the first, from the moment you have the baby to those first 3 months, you really want to focus on building a base back up. So maybe those first couple weeks, it is just putting the baby in the stroller and going for a walk. And that might just be 10 minutes a day.
Yep. Getting
that movement, getting that blood flowing. It's so good for your healing. So good to just get your cardiovascular system going again, your breathing going again, get those muscles working again for you, because all those things change during pregnancy.
That's right.
But then as you start to build that base a little bit, and you can incorporate those pelvic floor muscles strengthening from day one.
Okay.
In the absence of any pain. Okay. And we'll talk about that when we start doing some pelvic floor muscle exercises. But you can add those in right away. As you start to build that base up, you really want to work up to about 30 minutes of exercise, of moderate intensity exercise, 5 days a week. So the recommendation is 150 minutes of exercise, per week.
Got it. Okay. And so you mentioned moderate intensity, and I'm just wondering, when we think about the time, and mom's time is already spread so thin, is time more important or is intensity more important?
Yeah, great question. So what we want to think about is, you might not have 30 minutes
all in one sitting.
In one sitting. May not happen, especially for a little bit, So you can break that up. You can do 10 minutes, throughout the day. But your goal really is to work up to those 30 minutes at first. And then once you get to 30 minutes of exercise, hopefully you can do it in one chunk. But if you can't, then that's when you're going to start to build your intensity up. But you first want to build that baseline.
Okay.
Go ahead.
So we have this baseline. We're walking. We're already trying to do our Kegels and all of that.
Yes.
And then we get to a point of moderate intensity. When do we know we're ready for high intensity, or to get back to what we used to do?
Yeah. So when we think about moderate intensity, just to give you an idea too, that's like you and I going for a walk and we can still hold a conversation.
Okay. We're not breathless.
Yes, we're not breathless. If I can no longer hold a conversation anymore, that's when I'm starting to really work into more of that high intensity zone. Okay. Which in some cases, if you have that base build up, it's great. And let's work to that. And I always say, give your body that first 3 months to heal before you even start taking on any sort of high intensity or high impact exercises. So those first 3 months, it might look like, walking, swimming once you're healed and able to swim, biking once, your vaginal area is.
Yeah, you can sit on a bike.
You can sit on a bike. But when we know we're ready for high intensity exercise is when we can walk 30 minutes without experiencing any pain, any pelvic pain, any feelings of falling out, which may indicate that pelvic organ prolapse, or any sort of bleeding, right? That wouldn't be normal at all, and any leaking. So for having any leaking. So those are kind of the main things that you're looking for. And you could even try your hand at, can I jump? Can I jump 30 times and not leak? You know,
That's a hard one.
It is. It's hard.
Yeah.
You know, so, and there are some other exercises and things that if you go to somebody individualized, I think would help you best to really create that high intensity. But as a general guideline, if you're not experiencing any of those symptoms, you could try some higher intensity exercises.
Okay, and so whether it is just a baseline, it is moderate intensity, or it's high intensity, why is breaking a sweat and starting to move so important to not only our physical body, but when we think about our mental stability and even postpartum depression or anxiety, what is the correlation there?
Yeah, well, we know that physical activity during pregnancy and postpartum reduces the chances of postpartum depression. So we've seen studies across the board that show that. So it's so important for your mental health to do that, to get out and break a sweat.
Okay, so we are breaking a sweat and we're doing it so that we are stronger, and we're just giving ourselves a baseline, and we're gradually moving to the intensity that's appropriate for our bodies. Not what the doctor says, not what society says, but just listening to our own bodies. So go ahead and listen to your body and write about movement in your journal now. All right, Liz, this has been so informative, even from just knowing what that looks like in there to knowing when and how to break a sweat. What other words of wisdom would you leave for these new mamas?
Well, I know when I was, going through this postpartum period, I was constantly online, constantly scrolling, looking at other new moms back at the gym, trying to compare myself to them and where I was in my journey. And so my biggest advice would be, don't compare your 50-yard dash to somebody else's marathon that they're running, because you just can't do that to yourself. Really try to give yourself grace during this time. And really, when it comes to social media in this postpartum period, if you're looking for exercises to do, or, you want to start a new program, there's a lot of advice out there. Okay, so you're gonna
Advice.
Okay. Yes. One person's telling you to do this. One person's saying don't do sit-ups, ever again. Somebody else is telling you don't run. Somebody's telling you to run. It can be very, very confusing, especially for a new mom. So make sure that you're looking at the sources of the certifications that these people have, their credentials. Make sure that they're certified in some sort of pregnancy, postpartum exercise, that they are certified physical therapists, certified exercise specialists that are trained, before you take this advice, because there's lots of good advice.
Yeah. And Liz, I love that, because as much as I want to brag on all my friends that I've introduced you to, I'm showing you their bios and their credentials, like all of the letters after Liz's name, for a reason, because she is somebody that you can trust. She's not just another influencer on social media, right?
Exactly.
Yeah. So what about this idea of opportunity? Mom's time is so thin, and getting 30 minutes in 5 times a week can seem daunting, but I wonder, how many minutes are we scrolling on social media?
Exactly. So that time spent scrolling could be a missed opportunity to go for a walk, to get in a workout, or maybe it's just to spend extra time with your kids or your husband. Maybe you could put that pelvic floor to use with him in those 30 minutes that you're scrolling, So there's tons of ways to incorporate your pelvic floor, instead of scrolling.
Yes, Liz. This is such a gift. And I want you guys to spend some time thinking about, is social media helping you? Are you joining the B times 3 community and asking questions of other moms that are in a similar season? Are you looking at the credentials of the people that you are comparing yourself to and idolizing? Go ahead and reflect in your journal now.
So a lot of people are told to do a Kegel or to contract their pelvic floor, but a lot of people are doing it incorrectly, and they're not really quite sure how to find their pelvic floor.
Okay.
Okay, so I'm going to teach you how to find your pelvic floor right now.
Okay.
Okay, so the first thing I want you to do is imagine that the pelvic floor, the bottom of that bowl, is like an elevator. And right now when you're sitting here, the elevator is on floor 1.
Okay.
Okay.
I'm going to floor 1.
Yep. And what I want you to do is I want you to imagine like you're stopping the flow of urine and gas, and you're closing those elevator doors. So you're squeezing.
I went all the way up to floor 7.
Okay. Okay, so let's relax. So that's good though. Did you feel your...
I mean, I felt like I bounced.
Yeah, and I
Okay.
saw you move.
Okay.
Which is
Not
telling me
good.
that you're probably not doing it correctly.
Okay, sorry.
It's
try
okay,
again.
but
Yeah.
this is very common. So let's not do it as intense this time. What I want you to do is I want you to imagine slowly closing those doors this time. Okay. Now I want you to imagine lifting up, but keep your glutes, your butt muscles on the chair.
That didn't happen.
Okay. I saw you rise up. I don't want to see you rise.
Okay.
Okay. So nobody should know that you're doing this exercise.
Okay.
Okay. So what I want you to try again is gently close those doors and
Okay.
imagine that you're going up to floor number 1, 2, 3, 4.
I'm
And
trying
maybe
not
that's
to
as high as you
move.
can go. That's good.
Okay.
Now bring that elevator back down.
See, and I just like dropped the bottom out of it. I
So
know.
that lets us know that you don't have much control over
Yep.
your pelvic floor.
And ladies, my youngest is 6, so it's okay if you're struggling along with me.
Yes, and that's very normal for you to feel this way right now.
Okay.
However, we need to get that stronger.
Okay.
Okay. Or else you'll continue to pee when you laugh and you cough and you
Yep,
sneeze.
that explains everything.
Okay.
Thank you.
So maybe that's where you are right now.
Yeah.
Maybe all you can do is hold it for 2 seconds.
Okay.
Maybe all you can do is get up to that second floor. So let's start there.
Okay.
Okay. So make sure you bring it up. 1, 2. Now relax and bring it back down.
Okay.
There you go. And make sure it relaxes completely before you contract it again. So the problem that happens is people just Kegel, Kegel, Kegel. They'll get off their chair. They'll think
That's
that
literally what I think I've been doing since I had kids. I was like driving along in the car
Yes.
thinking as long as I'm bouncing down there, I'm doing something good for me and for Kenny.
Exactly. But unfortunately, you're really not, maybe you were getting a little bit of those muscles, but we really want to try to isolate those in the beginning.
Okay.
Okay?
Got
So
it.
you want to try to work up to 10 seconds. You want to try to hold it for 10 seconds and then relax it for 10 seconds.
Slowly releasing it. for 10
Slowly
seconds.
release and then just let it relax before you contract it again.
Okay.
Okay. Once you can do that 10 times, then you can start to add in more repetitions. Okay. But you also do want to work on those quick ones.
Okay.
Okay. So those long holds that we just did, they're great for if you're walking through a store or you've got to, take the baby places you're going to be out all day long. So we call those endurance muscles.
Okay.
Think about like a marathoner.
Right.
But we also need to work those quick sprinters.
Yep.
So that's when you're going to contract, relax, contract, relax, contract, relax.
I'm trying not to bounce, Liz.
You're trying not to bounce. And
Okay.
I can't personally tell if she's doing it correctly without looking. But you guys can. You can always get a mirror. You can see, am I squeezing, your glute muscles? Or if they're contracting too, you're doing too much.
So
okay?
if I have a mirror down there while I'm doing these, I
Yes.
can see everything that we...
You can see the outside. You should see it move inward a little bit.
Okay.
That perineal area, that area right between your rectum and your vaginal opening, this area here,
Okay.
that might move inward a little bit.
Okay.
But if your butt cheeks are squeezing together, you're doing too much. So you want to make sure you're doing both, those long holds and those short holds.
Okay.
Okay.
Well, Liz, I will keep working on this.
Yes.
And all of you will keep working as well. All right, moms, I don't know about you. If you're similar to my age, maybe you had a magic nursery from the 80s or 90s or a Cabbage Patch. Did you have one of
Oh,
this?
definitely had Cabbage Patch.
Cabbage
yes.
Patch.
Yes.
Okay, well, I kept this. This is my little Geo from when I was little, and Geo plays with it now. And so if you're going out for a walk or you're not ready for that mid to high intensity and you just want to get your body moving, you're going to grab baby Geo, and Liz is going to give us some tips for baby calisthenics.
Yes, great. So I love squats. I know you're all cringing right now. Why? But they're such a great full body exercise. And so around like the 4 to 6 weeks, you can start doing squats as long as you're free of pain.
No pain.
Okay. You want to have no pain, no bleeding. So it's all going to be dependent on where you are. This one, you might just be doing little mini squats at this point.
I can handle that.
So we can handle that.
Come
right?
on, baby Geo.
And now we're getting past that 6 to 8 week mark. We really want to start picking things up. So now I want you to keep Geo really close to your body, okay? Because that's really important for our core and the baby, and security for the baby's head, okay? So you're holding the baby. Now what you're going to do is you're going to sit back like you're sitting on a toilet. Okay. Yep. And then come back up.
Okay.
All right. Now, if you're at that 8 to 12 week mark, you might go like this and say, oh my gosh, I just peed my pants. Okay. So what's going on? What can we do to incorporate everything we've learned already today? So we can squat down, do that pelvic floor contraction as we come up.
So this time it's okay for my butt cheeks to move?
Yes.
Okay,
yes,
just checking.
Yes,
all
exactly.
Right.
Because if all we did were Kegels sitting in a chair all day, you wouldn't be able to have any control when you're doing movements like this.
In real life.
In real life. So we need to start incorporating your Kegel while we're doing exercises. Okay. So let's try that again, Nancy.
Great.
So let's squat down, do your pelvic floor contraction, and come up. So you're always going to do that pelvic floor contraction when you come back up. So even when you get out of a chair.
Okay.
So this
every time I stand up. Yep.
Very functional, right?
Got it.
Okay. I don't like to waste time, and I know you guys don't either. So now we're ready to start doing some overhead lifting. Okay. So now we can do the squat, and then as you come up, you're gonna lift Geo overhead, and you're gonna say, "You're so cute."
Oh, give him a baby kiss or something.
Yes.
Yeah. Okay.
So now let's try it.
All right.
Right.
Yep.
Okay. So let's squat down, Kegel, lift baby up.
Hi, baby Geo.
Good.
Okay.
But as you just did that, your abdominals kind of flared out, and you weren't able to control your abdominal area.
Yep.
So now we're going to add another layer when you do that. I know,
Okay,
I'm
Liz.
terrible.
No, you're good.
Terrible.
Let's do it.
All right. So as you lift Geo up, you're going to exhale.
Okay, so I lifted Geo.
Yeah. As you do it, you're going to go.
Oh.
Yes.
Okay.
So when you just did that, you should have felt those lower abdominals engaged like we did with the exercise earlier. Okay. So here we go. We're going to squat down. Ready? Kegel. Good. Let's do it again.
Okay.
Squat down. Kegel. Great.
Yay!
Yes. So you can make this squat go from easy mini squats. You can make it more intense by going further down. Now you have the baby weight of Geo to help increase the intensity. And now you're making it super dynamic by adding in that overhead press. You can also increase the speed to then get more of that moderate intensity cardiovascular effect.
Okay, so how many of these do you think we should do? Does it depend on where we're at?
Yes, so it's definitely going to depend on where we are. To get good strength gains, you want to do at least between 8 to 12 to the point where you feel like you can't do another one. So that means you either need a heavier baby probably at some point.
Which will happen.
Yes, yeah. So if you're working on strength. If you're working more on that endurance, you want to do between like 15 and 20 of them. Okay. So again, that's where it's going to really depend on the individual, but just some general guidelines.
Awesome. Well, go ahead and practice your baby calisthenics now. All right, mamas, you are now part of the B×3 community, and so I brought out the yoga pants for you today. I also took off the blazer, and you guys are gonna get an intimate view of my mom bod. And remember, I feel at a level 3, and I've done a lot of work to get to 3 out of 5. And so I just want to thank you for all of your grace as we go into some of these exercises. I'm trying to be super vulnerable, and I hope that you will be vulnerable too. So Liz, we are going to talk about our core.
Yes. So what we talked about earlier with the diastasis recti is we're going to show you how to check it yourselves.
Okay.
To see if you have one and to see that maybe that's something that might be limiting you. Okay. Just because you might have a separation in that area doesn't mean that that's a bad thing either. It doesn't mean it could cause pain or anything like that. It just means, hey, maybe you should go talk to a professional and get some advice on where to go with that.
Okay. All right. I'm laying down.
Here we go. Let's check it out. All right. So what we're going to do is we talked about how the diastasis recti is that separation or thinning of this connective tissue throughout that area where that rectus abdominis, those six-pack muscles connect. Okay. So I'm going to check, and I'm going to show Nancy how to self-check that area. So when I check, I'm really looking, is there any sort of like width or separation between that area there, okay? So anything more than 20 millimeters or 2.5 finger widths is defined a diastasis.
Okay.
We're also going to check for depth. So when we touch 3 different spots, we're going to see how far do Nancy's fingers sink down into that area.
Okay.
Do they sink at all? Or do they feel like they're going to touch her spine when she sinks in and it's like a bottomless pit there, okay? Yep. And we're going to see if she's able to create some tension.
Okay.
Okay?
Let's do it.
So the first part, Nancy, I want you to take those fingers and you're going to feel about to like a little bit above your belly button there. Okay. And I'm just going to pull this down just a little bit.
Yeah.
There you go.
B3 community.
Exposing
Here you go.
it all. You go, girl. All right. So we're just going to check first without her doing anything, see what that feels like, go back and forth, see if she can feel the sides of her abdominal muscles in there.
Okay.
Okay, then check right at the level of the belly button. Yeah, right there. You're just
it's a little squishier than the other one. Yeah.
Like. And then let's go right below the belly button and see what that feels
Definitely squishier.
Okay. Well, that's fine. But what happens now when we add some tension to it?
Okay.
So let's go back to that first mark. Okay, right there. Good. Now, what I want you to do is just lift your head up off the table. What do you feel when you do that?
It's tighter, yeah.
It's tighter. Good. It looks and feels like, to me, feels kind of like a trampoline. That's perfect. That's what we want.
Okay.
Yep. Let's go right at the level of the belly button.
It feels like a bottomless pit.
Yeah, it feels like it sinks. So she's got a little bit of a diastasis there. So if I put my fingers in there, I can sink in pretty deep there. Okay, so a little bit going on there. We could work on those muscles there.
I'm taking you up on that.
Yeah. And now she's going to go right below. Go ahead and come up. Yeah, that feels pretty good. Yep. A little better right in there. Yep. So I can't really get my fingers in between anything. So that's what we're looking for there. Okay. So you can do a self-check on yourself. Now, because we found, something going on there, and plus these exercises are really good even if you don't have a diastasis, but just to really work the whole core area. What we're going to do first, a first good exercise is to just start working on your breathing, believe it or not. Okay. So what I want you to do is you're going to inhale. And when you inhale, I want you to feel your abdominals expand, your sides expand, and your back expand.
Okay. So just inhale.
Just inhale first. And then exhale. So what's happening with Nancy, too, is a lot of her air is staying up here. In her chest. Yeah. And that's very common after having a baby, too, because that baby pushed your diaphragm up.
Everything went up.
Yep. Everything moved.
Yep.
So now we're trying to open everything back up again.
Okay.
Now on the exhale this time, you're going to work that inhale all the way down. On the exhale, you're going to blow that air out as much as you can, almost as if you're fogging up a window. So think about.
Okay.
Okay.
All right. So I'm going to inhale.
Inhale, nice and big, like an umbrella. That umbrella is opening. Now exhale. Good. Now, what did you feel as you exhaled in those lower abdominal areas?
I felt tightness on the side. Is that the right place?
Yeah. Okay. So as you exhale like that, you engage those lower abdominals. And we need those lower abdominals or those transverse abdominal muscles to be engaged, as well as we need those rectus abdominals to be engaged in order to help close that gap if you have one, or really just let's think about it. Don't even worry about the gap. Think about just generating tension.
Okay.
Okay. And that's going to help that core. Okay. So you can start there.
Okay. So based on everything that you have learned today, let's not get overwhelmed. We're not going to evolve into that butterfly overnight. So what's the one thing that you can do today to grow your physical strength in your mom bod? Go ahead and put it in the B3 journal now. Our expert Liz is not the only one with advice on our physical bodies. God left us some advice in the Bible as well. So let's go ahead and start in 1 Corinthians 6. Paul was bringing the news of Jesus as the Messiah to Greece, and he visited the city of Corinth. Now, this was a very wealthy town center. It was a cosmopolitan area. It had a ton of commercial trade going on, and many people there became believers because of Paul's work. Well, when Paul left the city of Corinth, they wrote him a letter asking him more questions because some of the Corinthians started adopting common Greek ideas about physical things, about their bodies. In verse 19 and 20 in chapter 6, this is what Paul has to say. He says, "Do you know that your bodies are a temple for the Holy Spirit, who is in you, whom you have received from God? You are not your own. You were bought with a price. Therefore, honor God with your body." Mama, your body, it is a gift from God, created on purpose. Sometimes we are too tired and too busy to treat our body like a temple, like a gift. And I get it. 6 years later, I'm still dreading this conversation. Have you ever thought of your body as housing God, housing the Holy Spirit, the gift Jesus left behind for us to stay connected to God? It lives in you. Our connection to God no longer happens in a building. It happens in our bodies. So respect your body. Take pride in your body. Take time for your body, no matter what, because you use it to honor God. Okay, so what if you get this in theory, God is within you, your body is a temple for the Holy Spirit, but you're still tired and you still can't find time and you're still a busy, overwhelmed mom with little ones and zero time to yourself? I get it. I'm still there 6 years later. In Philippians chapter 1, Paul answers this. Paul wrote this letter to the people in Rome, not the people in Greece. Paul was trying to start a church in Philippi, and this is where there was a colony of retired Roman soldiers. They became huge supporters of spreading the gospel of Jesus, and because of that, Paul was thrown in a Roman prison. They sent Paul a letter in prison telling him that they were raising money to get him out of jail so that he could spread the good news about Jesus. And Paul wrote this letter back to the Philippians. So in chapter 1, verse 6, it says this: "Be confident of this, that he who began a good work in you will carry it out to completion until the end of days of Jesus Christ." So, what does that tell us about our mom bods? Well, it tells us that God created you to be a butterfly. He started a good work in you with your body. You have evolved from that caterpillar. You have made your way out of the cocoon, and he will finish teaching you how to fly. He will finish showing you how to eat. He will finish showing you how to live in this new season. He will show you how to be the strongest and most beautiful version of yourself that he created you to be. So, what do these scriptures mean to you? In your journal, think about what treating your body like a temple means. Think about letting God finish the work of his creation of your mom bod. Can I pray over your mom bod right now? Go ahead and get comfortable. Shake it all out. Close your eyes. Let's talk to God. Dear Heavenly Father, thank you for seeing me as a butterfly even before I saw myself. Thank you for creating me. Thank you for helping me evolve. Thank you for teaching me how to fly. I bless every mom bod watching this video. I want to pray blessings of strength over their soft tissue, over their mental health, over their evolution, over their body. Dear Lord, let them know that you are not alone and you are not complete, that you are going to continue to do a good work in them to make them stronger because you want to live inside of them. You want to reside in that body so that they could be a light to their children, to their husbands, and to their communities. Help every mom watching this treat her body like a temple that houses you, a butterfly that evolves and flies with strength and beauty. Thank you for creating our mom bods. Thank you for helping us get stronger. In Jesus' name we pray. Amen. So like I said, this was my least favorite one to do. And so if you're like me, this conversation is not going to end after the postpartum season. We are going to continue to have this conversation together for 6 years, for 10 years. I don't think it honestly ever ends. So I want to continue to encourage you to post in the B3 Babes community. Let us know, how's the soft tissue doing? Where are the bones? How are you feeling? Do you have any tips and tricks for treating your body like a temple for the Holy Spirit? You are not alone. And we want to make sure that we are using social media to fill our souls and to strengthen our bodies. So I want to thank you for giving me this time to invest back into you and into your body. We have a ton of resources for you on this topic because we know it's a hard one. So if you need anything, reach out to B3, and we'll see you on the next video. Bye-bye.